Welcome to Wellness Wednesday. Welcome to Ask Your Doctors. I am Dr. K. I am with Dr. Bunola Mashishi. How are you, Doc?
I'm good. How are you?
Okay.
Good.
Be honest. We are back in Johannesburg, guys, and in our studio in Johannesburg. Are you glad to be back?
I am glad. I am glad. No, Durban was nice, but you know, this is home, so it feels good to be home.
Nah, Devon is home for me, but that's a story for another day.
Is it?
Yes, guys, welcome. And today we have none other than Dr. Morwesi Mahlangu. Welcome, Doc.
Thank you.
And she is from GEMS, where she works as a senior manager in the medical advisory services. Did I get that right?
I am the senior manager of the medical advisory services.
Awesome. Rather you say it than me. Thank you. It's a tongue twister. Anyway, welcome. Thank you for making the time. We have been wanting to interview people from medical aids for a long, long time for obvious reasons. And one of the reasons is because people always have certain expectations about their medical aids, and we would like to clarify some of that. And so, Dr. Bunola, it is ladies doing their thing. I will watch the tennis match again and do this. And so, yeah, over to you, Doctor. We would like to debunk what people expect when they come to our practices. I believe today we're talking something gynecology. Do you want to elaborate on that, please?
Yes, but before we do that, it's kind of a tradition on the show when we have new guests, maybe to share a little bit about you, your story, your journey, and how you got to be where you are today. I mean, the aim is always to inspire young people out there who may consider doing what you're doing.
Oh, okay, thank you. So I wasn't always sure what I wanted to do. And we all know our parents, they're like, hey, there's medicine, there's nursing, there's teaching, there's engineer. You know, they always want to make sure that we sort of have safe careers. But I've always been drawn to the sciences. So I did medicine. I went to Medunsa and I qualified in 2004. And I stayed in clinical medicine for a couple of years. At some point in time, I worked in casualty, typical adrenaline junkie doctor. But then I thought, no, maybe this is not my niche. Went into GP services. Liked it for a while, was a GP, family medicine, saw patients, and I was like, nah, maybe this is still not for me. And what a lot of people don't know about medicine is that there's so many different types of doctors. I ended up at some point being an aviation medicine doctor. So I was trained in aviation medicine with the Institute of Aviation Medicine, which is part of the South African Defence Force. I then worked at the Civil Aviation Authority there for a number of years. And then I ended up working as an emergency medical assistance doctor in a call center though. Also dealing with emergency evacuations over the phone and helping people with any emergency medical condition or situation that they may find themselves in, whether in this country or anywhere else overseas. And eventually I decided to have a change of pace and change my career. And I ended up in the medical aid industry in 2017. And currently now I work at GEMS as the Senior Manager of Medical Advisory Services.
Okay. Sounds really cool. And I like how diverse the story is and the journey is. I mean, you have a lot under your belt. So that's really, really phenomenal. Yeah, yeah. So going back to what we are talking about today, and sorry, before we get there, any regrets about leaving clinical medicine? Like, what do you enjoy most about what you do?
No regrets. I'm one of those people that feels that sometimes you do have to have a change in pace, a change of your career. I always say to people that when my medicine ends, I'll probably go and be a patisserie chef. I like to bake. So I don't have any regrets. I do miss sometimes seeing with patients, dealing with patients, but you find ways of healing and helping a greater number of people in various different non-clinical professions that we have. I mean, when I was doing aviation, that was dealing with legislative drafting and regulations for the whole country, you know, to keep passengers safe and members of the society safe, that use our aviation system and airlines and airports and various things. I was part of aviation when the first swine flu and aviation and bird flu first broke out. And back then the story was, how do we keep, you know, airline passengers safe? How do we prevent it from spreading all over the globe? And as we saw exactly what happened with COVID, with some of the regulations that had to be instituted. So I don't have any regrets. I always find amazing things that you can do, and I always look at how is my sphere of healing or influence has become greater since I've gone into non-clinical medicine.
Yeah. I hope you can see how starry-eyed I am and looking at you, I'm like, oh yes, I can sit and talk to you. But going back to topic at hand, what are some of the controversies with regards to medical aid? I mean, yeah, that's why we're here today.
Okay, main one is we don't pay for anything. You know that one. We don't pay for anything. We are...
You mean that's a misconception, is that?
It's a misconception, and it could also be true. Funny story is, I think it was yesterday morning, yesterday morning, I was even fighting with my own medical aid about why they haven't paid something. And as I put down the phone, I'm like, but I even work at GEMS, and now I'm fighting with GEMS as to why we haven't paid me on one of my claims. But it happens, so we don't pay claims. Medical aid finishes by September, or actually by June.
Not February.
No.
Okay.
Ironically, some
see
people
the
do
wrong
have
patients.
medical aid by February. This is September. A lot of people, they have no funds left in their medical aid. Misconceptions is the usual. We're not going to authorize anything. You're not going to get any medication. You can't see doctors. You're not... Yes. And also people do believe the other inverse of that is a medical aid must pay for everything. Every single thing that I want, when I want it, must be paid for in full.
Because I'm on medical aid.
Because I'm on medical aid, I deserve to be in a private room in the hospital in full.
And it's all about access, right?
Yes, it is.
Access whenever, however I want
Whenever,
it.
however, how I want it.
But given the misconceptions that you've just highlighted to us, then how do we then make healthcare a little bit more accessible? What do we need to do in order to make it more accessible?
So even studies have shown, and this has come up, and it's a common problem, and we say this all the time, and people don't realize this, is how well do you know your medical aid? Do you know what it pays for and what it doesn't pay for?
No,
Have you read the brochure?
To be honest, no.
There you are.
We just signed.
We just signed.
Because we know it will cover everything.
Yes, and have you...
We assume it
You
will.
assume it will cover
Yeah.
everything.
We know.
Have you read the fine print in the application forms?
No.
What it says you're signing your life away for?
No.
No, okay. And that is the problem. People don't read the application forms. They don't understand what's contained in there. They don't understand underwriting. They don't understand waiting periods. They don't understand
Pre-existing conditions.
pre-existing conditions, that when you join a medical aid with a pre-existing medical condition, they are allowed to have you on a waiting period of 12 months. And that means there is no cover for that condition for a whole 12 months.
12 months.
And even it's in the regulations, and I think people also tend to think that medical aids make up some of these things. But if you go to the legislation, the Medical Schemes Act, and this is also to empower members in medical aids, if you feel as if your medical aid hasn't done right by you, you can also pull up the legislation with regards to the medical aids for the Act and the regulations, and read what legally your medical aid is supposed to be doing. So that also helps dispel your own misconceptions, gives you education of what legally they're supposed to be doing. And also, if you feel that you've been done wrong by the medical aid, you then also understand what recourse you have as a member of the medical aid. And also going onto the website of the Council of Medical Schemes, because medical aids is a highly regulated environment. So we don't do things willy-nilly and wake up in the morning and decide, okay, today I'm not paying anything for Bonolo. No, that's not how it works. We also have to make sure that legally we are in line. And if the Council of Medical Schemes says that, nope, you guys are wrong, we can then say, okay, fine, we agree with you or we disagree with you based on the various interpretations of how we see the law. So it's a highly regulated environment. And people don't understand that.
Okay. So maybe because you're here to help us understand, let's use women and conditions, gynecological conditions that affect women as an example so that we can all understand. Let's talk about fibroids.
Yeah.
You know, what do we need to know? What does medical aid cover? What other conditions do we need to be worried about?
So it doesn't matter what medical aid you're on, right? So always the basics. What option are you on? And the best way to explain your options is, it's very simple with cars, right? So you buy a...
I don't like where this is going.
I'm so sorry. Because I might say the wrong car brand in Askis. So let's say you buy a Toyota Aygo, but you expect it to perform like a Mercedes-Benz, right? You don't have the same features of a Mercedes-Benz, correct? You don't have that. So you have an Aygo, it has the features of that Toyota. You have a Mercedes, it has the features of that Mercedes. You have a Bentley, it has the features of that Bentley. So you need to know which car group you have bought into, number one. Then you have what we call network options and non-network options, right? Network options tend to be cheaper because people see, because they are also limiting. They're limiting in a way, but now people look at price sometimes. Mind you, I'm not a broker, I'm just explaining general. They look at price and like, I want this network option. And we do get complaints, even as GEMS, as members are on a network option, but they don't understand how a network option works. You must go to your network GPs. You must go to your network specialists. You must go to your network hospitals unless it is a emergency consultation. And that term, even emergency, is also regulated as to what dictates an emergency in our industry. So you have to always check the regulations and understand how your medical aids work. So when you have a network option, always remember, go to your network doctors, your network specialists, and your network hospitals. But when you have, let's say, fibroids, right? You go for a routine checkup with your GP or your GYNAE, which a lot of women also need to start doing that on a regular basis. You find your diagnosis of fibroids. Then what happens is that once the doctor will then discuss with you the various options you have for treatment, you know? Are we going to look at surgical treatments or non-surgical treatments? Are we going to look at forms of contraceptives or not? Are you going to go for surgery? Like, are you going to have a myomectomy, which is actually removing of the fibroids? Are you going to eventually have a hysterectomy, which is the removing of the womb? Or are you going to have what's called uterine embolization, where they cut off the blood supply to that fibroid, which is also non-invasive?
So myomectomy is an open procedure where we cut open and we take out the fibroids that we can see. But you can also do a closed myomectomy where you go in with cameras and then you remove those fibroids. It obviously then depends on the size of the fibroids, and how big they are. Will they be able to be removed laparoscopically, or do we have to go in there and open you up? There's also other modalities, like you mentioned, uterine artery embolization, to see if you can try and burn the blood supply. You can also burn the actual uterus itself, the cavity. It's called uterine ablation.
So they'll discuss with you the various options. And also they'll discuss with you what exactly your medical aid could cover, right? And it's always important to seek pre-authorizations, right? Make sure you have the information, your doctor's names, your doctor's practice, your ICD-10 codes, any other procedural codes that they would give you, and always apply for pre-authorization well in advance. We all know as human beings, we tend to do things last minute. And then we complained we didn't get authorization on time. But you sought authorization 24 hours before.
Especially if it's a planned procedure.
Exactly.
If you have had a month or two or a week or two, do it as soon as possible so that you can,
Yes.
Plan ahead.
Yeah.
Also to allow the medical aid to allow the process. If it takes 24 hours, 72 hours, it's a weekend, give them time to do
To
this.
process.
I don't want to sound like I'm advocating for medical aid. I'll never do that. But in any case, speaking of networks, it's also fair to say that it does not mean that networks are slightly inferior in terms of the quality of service.
Thank you.
It is just an arranged situation where the network arrangement between the practitioners, the facilities, the specialists may end up with a better cost-saving mechanism for everyone involved.
Yes.
So, and then people are directed to certain. If you don't want to be on a network, you don't want to be on a network. It's fair, whether you're a patient or a practitioner. Yeah, because I know there's a brilliant facility in Soweto. I'm advertising for
Now
them
you're
now.
advertising,
Yeah,
yes.
which is cool. It's fine. We're brothers in arms and all, and it's in a township. But look at the facility when you get there, and they do network work.
They do.
Yeah, they do network theater work and all that, and they sometimes a patient will leave our practice in Fourways and go to Soweto to get the job done there and still get access to us, the
Yes.
same people that work in Fourways.
Yes.
It's just in a facility where the network will work better for them.
Yes.
There. So it doesn't mean there's any inferior service that you will get. Yeah. So, Doc, you spoke of these cars. Anyway, never mind about cars. I got hot under the collar when you mentioned the last one. Savings, gems. Do you guys have savings?
A savings?
Yeah.
Yes, we actually have just only one option
Yeah.
with savings.
It's your platform. What is it called?
It's called Ruby. It's a
Ruby.
Ruby option.
Oh,
So
okay.
all our other options are what you would call traditional medical
Yeah.
aid, where it's where you get your benefit for the year. So this is your day-to-day benefit. This is your dental benefit. This is your physio benefit or your optometry for your glasses. It's, yes, so but there is one option with savings.
Okay. Let's go back to fibroids. Can you tell us, related to fibroids, what is prescribed minimum benefits? Say one without the other and then put them together.
Okay, so
Okay.
prescribed minimum benefits is a list of 270 conditions that come with diagnostic and treatment pairs as the official terminology used. So it includes what investigations, the treatments, and what ICD-10 codes, your diagnosis, that are contained in those pairs of 270 conditions. That is what your medical aids are legally obligated to pay for,
Like
as
TB?
per the legislation, like TB, pregnancy,
HIV?
HIV, diabetes, and then you have your chronic conditions that we are legislated to pay for.
Okay.
Certain cancers fall into your prescribed minimum benefits, but it has to be within the specific defined terminology of what a PMB is.
So what does that imply for the common person? If I am on medical aid and my funds have run out, my money has run out of my medical aid, but I have TB or one of these conditions.
They have fibroids.
So if it is a PMB, your medical aid will still cover it because we are legally obligated to pay for your PMB.
Okay.
So at GEMS, if you have a benefit, right? So let's say your medical aid runs out, which is very common by now. A lot of people don't have medical aid, right? But you have a PMB condition. It will continue to pay out because legally we have to cover it. And which are some of the benefits of having a medical aid?
This being Oral Health Awareness Month, I think for us it even includes wisdom teeth extraction. Some people with excruciating pain in the wisdom tooth area. We've been fortunate to cover some of them on some PMB arrangement when the funds had run out. So guys, if your funds have run out, let's read the fine print. If something falls under the PMBs, in consultation with your practitioner, they can advise you on whether you still have a chance or not of it. Please ask questions of your practitioner. Thank you for that clarification, Doc. And regarding fibroids, is it one of the PMBs?
No, unless it falls into any other category, or they come back and they find that it was some type of cyst or malignancy or something that is within a category within the PMB. But usually it is not a PMB condition. So then that means that it is subject to scheme rules, which is a whole nother thing that people need to understand. And also, different medical aids pay practitioners different rates, as I'm sure you know very well. And it doesn't help to say to your practitioner or your doctor, do you take medical aid? They will say yes, but it doesn't mean that they will charge your medical aid rate, right? So that's another problem that people don't understand. And then you get what's called a co-payment. My medical aid didn't pay in full. So when you have fibroids, discuss with your gynae. Do you charge the GEM scheme rates? Do you charge the Fed Health scheme rate? Am I going to have a co-payment? Also speak to the anesthetist who might not either charge your scheme rates also. Ask them, the anesthetist that will be helping in my operation. Make sure every healthcare practitioner involved in your treatment takes medical aid, because that is a way to minimize your co-payments. And that is what really gets people at the end of the day. And we have a lot of complaints about that, is I have medical aid, but why do I have to still take money out of my pocket to supplement?
Yeah. Which makes sense. I mean, you know, there's a whole chain in terms of management, and certain conditions require more than one practitioner. But my question really as a follow-up then, how do you go about this? Because, I mean, how do you access everybody in your chain of management? If I'm doing fibroids, for instance, I know I've discussed with my gynae, and, you know, we initially maybe start with non-surgical treatment. I know I'll be engaging with just them. Then later on, you know, I'm not responding, and then, you know, I have to look at surgical options. That widens the pool of practitioners. Then how do I access those people? I mean, am I doing the door-to-door knocking? Do you cover this? You know, those sort of questions, yeah.
So,
I think I can help answer that one.
empowerment, yes?
People need to put emphasis on the pre-authorization period.
Yes.
Because you need to ask your GP. You interact with your surgeon or GP.
Yes.
You say, can you guide me of all the people that will be involved, and let me walk this pre-authorization stage with you, and not complain after when things either haven't been authorized, or we went into the theater and I signed something that the excess is my responsibility and now I have to pay excess.
Yes.
So the pre-part, we fight with practitioners, even in our groups of practices, to say the patient needs to understand that they will attain value from 1 to 3, and then they are liable for 1 to 3. If they don't understand the value add to them, you can't make them pay for it. You know, so let's discuss everything before we dive deep into treatment and decide all those things. Yeah.
It's empowerment. I mean, and also we have to remember that previously, back in the days, medicine was more of a paternalistic type of area. It was the doctor, I tell you, this is what you're going to do. And as a patient, you said, okay, fine, I'll do that. But it's more about empowerment, especially as you as a patient. You need to be very involved in your treatment. Get involved, understand the condition, engage with your doctors. And as you said, utilize that time of the pre-auth process, because it's a planned procedure. And you don't want to leave things to the last minute. Because if you apply for pre-auth at the last minute, and then 2 days before your operation, it gets declined because the following information is outstanding, then you have to go and hunt down all those doctors involved in your treatment and get that final information. You might have to then push out your surgery. So it's very important. So for example, let's start with your non-surgical treatment. So let's say the doctor says, we're going to put you on contraceptives. Now you need to check, how does contraceptives pay on my medical aid? Is it going to come from savings? Which benefit does it come from? Is there a list of contraceptives that they will cover? Or is there a list of, or they cover every contraceptive but subject to available benefits? Or do I get a specific list in that formulary of contraceptives. So always make sure every step of the way you check, and you have to know your medical aid. We know the brochures are huge, but we try every year to try and cut down on the words in them.
And the words and the jargon.
And the jargon.
Yeah. So, I mean, in essence, basically, if you're going for a planned procedure, such as, you know, myomectomy or whatever it may be, pre-authorization is the golden key here. You know, take your time to plan and plan ahead with your doctor. That's what I'm getting. Okay, no, that's good.
And do you pay for the embolism, by the way? Are there schemes in your group of, are there options in your medical aid group that pay for it?
We actually do.
Is it?
Yes, we pay for embolization, subject to
T's apply.
subject to you meeting criteria for embolization. But yes, we actually do pay for embolization. I do know years ago medical aids didn't cover it, but we do cover it, subject to meeting criteria. And
it's a fairly new procedure, so
new-ish, yes.
yeah.
Yes.
Yeah, there's quite a few specialists that have come here that do it. So, and sometimes they would say subject to medical aid approval. Yeah.
It is subject to. Always discuss with your gynae.
Yeah. So we've already handled the procedures, the misconceptions about gynecological procedures to a certain extent. And do you have any that you can highlight?
No. So hysterectomies is always a big one. A hysterectomy, depending on what it is, tends to be a PMB. But as we said, always discuss and check with everyone in the chain. Breast cancer is a huge thing when it comes to your chemos. What falls within part of the treatment of breast cancer is part of PMB, and what falls outside of PMB, and how will that pay for? You know, we do have members who, the moment it falls outside of PMB, then they start to incur out-of-pocket payments. Another thing that we do cover is the reconstructive surgery post-mastectomies. So GEMS will cover that for your reconstruction. Then we've got your normal preventative benefits that should be covered, well, that women should be going for, and that are also covered. So yearly pap smears is covered at GEMS. Mammograms, very, very important. I would love for your viewers, please, please, go get your mammograms done.
And you say these are PMBs?
No, it's part of GEMS preventative screening benefits.
Okay.
Take advantage of your preventative screening benefits. And this does not come out of your daily, day-to-day benefits. Please, get your screening done. We have a low uptake of mammograms amongst our scheme members, and it's very sad because when breast cancer is caught early, so much can be done. So please, go for your mammograms. Go for your pap smears. Any other preventative screening that comes out of the screening benefits.
Because prevention is
better than cure.
Yeah. And look, I'm not going to trash colleagues or anything, but I am disappointed there's a low uptake on mammograms.
Yes.
But I sometimes, there's one case that I once saw where a child fell in a household and the tooth was broken. And the child went to a CT scan before they even came to us to try and do emergency work on the tooth. Now that got me very, very worried, because there's a period within the time of, there's a period from time of injury to us getting intervention or giving intervention where we can actually resuscitate the nerve tissue in the tooth. Now, queuing up for 4 hours for a CT scan or whatever scan or MRI, whatever it was, I was very, I was
Passionate.
Passionate about that.
Yeah.
Did we lose a tooth?
I don't remember, but I was just, the chain was broken very badly, and there were big costs involved before simple things could be done. That was the disappointment I had with the whole thing.
And you know what is sad? That CT scan, depleted benefits, and then they get to September and there's no benefits in medical aid. Some of the most basic and simplest things that you can do within medicine actually make your medical aid stretch. Doing a mammogram It's far cheaper than going through years of chemo and radiation. And it also ensures that you have a better quality of life.
Yeah.
I like that, Dr. Mo. So maybe, because we've highlighted some of the benefits and what the pros and cons of medical aid, especially from a financial perspective. But in a nutshell, when sharing the message to our audience, there are a lot of people are not on medical aid for a number of reasons. What are the benefits? Like, why do I need to be on medical aid?
All right. So medical aid is a grudge purchase. It's like insurance, any other insurance. Why do I have to pay so much for car insurance or house insurance? It's actually a just in case, right? And ironically, COVID actually allowed people to realize, I'm going to need medical aid. Because remember, the government hospitals were full. And at some point also, private hospitals were full. Medical aid will also allow you to just do your wellness checks. Go to your doctor. Get your screening for your mammograms. Get your basic screenings for cholesterol, diabetes, blood pressure, annual wellness checks. And depending on which option it is or which medical aid you're a member of, it will pay from your available benefits without you having to pay for a mammogram cash. Some mammograms can cost over 2,000 rand. Then you must still pay for all your blood tests cash. Then you must pay for that doctor cash. Then, and it becomes an expense when you could have had medical aid. And if anything is discovered, then you know that you are covered, especially when you have any PMB condition. Then, so what if you only use medical aid once or twice a year to check up on you? But you will always have that safety net to make sure that if anything happens, and God forbid, especially in a country where we have such high accident rate, you are covered. So I reluctantly pay it also, but I also understand the pros of having it.
Okay, Doc, let us go viral. Please tell us what you guys have been cooking up in your laboratories. People thought COVID was gone. Now the numbers are spiking. What you been mixing wrong there?
So, I mean, COVID numbers are always interesting. It's never really gone. And different parts of the world, different activities are happening. So when we bring it back home, for the last couple of months, we've seen very low numbers. So what we've seen now, we have different programs where we look for COVID, in addition to, us finding COVID in, when we go test and report, we look for COVID in wastewater. So that always is an early sign of what may come. In the past couple of weeks, we've seen that COVID has been increasing in those areas, and it's in different parts of the cities, in the countries, and already that's giving us a warning that we could be anticipating a sixth wave. But given how COVID behaved in the fifth wave in South Africa, we don't anticipate to go back to 2020. The numbers will be relatively low, conditions will be relatively mild, we hope, given what we already know about what's circulating in terms of variants, etc.
So is it still acceptable not to wear masks?
Masks, really, you can still transmit COVID. So if you are sick, you've got flu-like illness, it's better to wear a mask. Continue to sanitize, because whether you have symptoms or not, the virus can still be shed. So wherever you touch, you will still leave it there. It's really individual basis sort of thing, yeah.
No handshaking yet, right? No, let's not shake hands. And as a policy in our company, if you have flu-like symptoms, we test you for COVID. People say we waste money, but it's just to give us an indication of when you should come back to work. That's what we use it for, as a standard thing. Just so we know when you must come back to work. If it's COVID, we'll count the regulated number of days. If it's just seasonal illness, then we let it be.
But winter is a very tricky time because you have so many other respiratory viruses going around, and they can all cause downtime. People need to stay at home. So I wouldn't really, it's true.
Time is money.
No. You save in the long term. Because, I mean, if someone is coming in with flu can cause some serious
Thank
issues.
you, Doc. I don't like where this is going. Doc, I'd rather...
She's right.
I'd rather look at you, Doc. You know what you said earlier on, Doc, which is very positive, that most PMBs and include tests that are exploratory and preventative. I've always been on a hospital plan because of my affordability and my quest to try and keep healthy in other ways. And then I've always been pleased when I have done my PSA, prostate specific antigen tests, on my hospital plan, and it's been paid for. And I found that they're one of the most positive, probably one of the few positive things about medical aids. And I was quite pleased. And you said to us offline that there's a difference in that between a hospital plan that's provided by a medical aid and a hospital plan that's provided by a non-medical aid institution.
Yes. So I always encourage people, please know the difference between what's out there, right? So you have medical aids, and then you have your insurance products, which are your hospital plans, right? And always remember that a medical aid is required to cover PMBs, which is why your medical aid hospital plans will be more costly than your other types of products that you have out there for healthcare.
That may or may not be regulated.
Yes, that may or may not be regulated. And they fall within a different ambient of the insurance umbrella. So yes, your hospital plans, if you do end up with a PMB, they are medical aid covered as per the legislation, subject to scheme and medical aid rules.
T's and C's apply.
T's and C's apply.
So this is one of the misconceptions that you are helping us debunk. Not every product out there is equal to the other.
Yes.
Some are regulated, some are unregulated. We started with another misconception about medical aid will cover everything. I think we should emphasize medical aid do not cover everything. It depends on the option you are in, and it depends on scheme rules. And the story about the cars again.
Yes.
Yeah. Is there any other misconceptions?
No, but I think, you know, from my take-home message from this conversation is you need to understand what you're paying for, and you need to ask your practitioners what who they're working with and what rates they pay, because that's always going to come up. You know, some practitioners don't take medical aid at all, and then, you know, some do, but you have co-payments, etc. So I think that is a good take-home message for me. Yeah.
Yes.
I think it's a wrap, Doc. It's been a pleasure. And we would like you to give us some links to which people can go to gather this information firsthand, whether it's online or anywhere.
So one of a very good place to start with is the Council of Medical Schemes website, where they do explain to members of the public what is a prescribed minimum benefit, what is a PMB, what are chronic conditions, what is entailed. And that is a very good base to learn and understand your medical aid. And also they tell you what is your recourse if you feel that it was unfair, how to appeal. I always tell members, please know and understand your appeals process in your own medical aid scheme.
Okay.
Go to the website of your medical aid scheme. Download the scheme rules of a medical aid. Yes, there is jargon in there, but you can go to other websites like the Council of Medical Schemes, Dr. Google, amazing to understand what that jargon is. Go through your brochure, comb through your brochures, comb through the scheme rules, look at the Council of Medical Schemes, understand appeals processes. If they don't pay for chronic, find out why that chronic medication is not paid for. Appeal with it. Submit more information as part of your appeal. And if you're still not happy, and it's so ironic as a medical aid, I'm sitting here and saying this, you still have a right, though, to go to the Council of Medical Schemes, the CMS.
Because you are being transparent. Our audience deserves someone like you.
You still have every right to go to the CMS and lodge a complaint against your medical aid at the CMS.
For customer relations issues, where would we go onto the GEMS website? Which
So you go
section?
to the normal gems.gov.za, and you can click under for members, or you can scroll down to the bottom and you can dial the 0860 number that GEMS has, and the call center will guide you through to which area that you need to speak to within the various aspects, from pre-authorization processes to your chronic medications or just general inquiries.
Thank you, Doc. I hope it's not the last time we hear from GEMS. And in any case, to our viewers out there, please also go to our website. You will find relevant links to these websites and other platforms where you can get more information on how to keep you informed and how to uphold your rights. And if you're a brand out there and you feel like you would like to have your products showcased on our platforms, please do not hesitate to go to the link that you see on the screen now. Drop us an email, go to our website, or drop us a DM where you can just tell us that you are interested, and maybe, who knows, one day we would collaborate. Anything for you, Doc?
Yes, to remind all the audience out there to click the subscribe button, and yeah, we look forward to seeing everybody again soon.
Thank you, Doc.
Thank you.
Thank you. Thank you.